Welcome to Coding Clinic Update, third quarter 2016. We also have in this Coding Clinic a discussion of the 2016 Sepsis Diagnostic Guidelines, where there's a discussion of the new sepsis guidelines established by the American Medical Association, and coders are questioning whether ICD-10-CM codes for sepsis may be assigned based on the new clinical criteria. And the statement unequivocally points out that coders should never assign a code for sepsis based on a clinical definition or criteria or clinical signs alone. And the third paragraph here tells us that code assignment is based strictly on physician documentation, regardless of the criteria the physician used to arrive at that diagnosis. And that statement is a very important statement that is consistent with new guideline given to us fiscal year 2017, A19, which we're going to discuss in a moment. And lastly, refer to the official guidelines for coding and reporting when assigning codes for sepsis, severe sepsis, and septic shock. The official coding guideline here tells us, and this is not a new concept, that code assignment and clinical criteria, how to assign those. The assignment of a diagnosis code is based on the provider's diagnostic statement that the condition exists. The provider's statement that the patient has a particular condition is sufficient. Code assignment is not based on clinical criteria used by the provider to establish the diagnosis. Coding Clinic fourth quarter 2016 discusses this guideline at length, and so will we in our fourth quarter 2016 Coding Clinic update session. Questions pertaining to the previous statements in Coding Clinic. Question: we have seen recently issued consensus definitions for sepsis and septic shock. How and when will this affect the coding of sepsis and septic shock in ICD-10, and will the cooperating parties be modifying the guidelines because of the new clinical definitions? And the answer is consistent with Guideline A19 that we have reviewed. The coding guidelines are based on ICD-10 classification as it exists today. Continue to code sepsis, severe sepsis, and septic shock using the most current version of ICD-10 classification and the most current ICD-10-CM guidelines for coding and reporting. Code assignment is based on provider documentation regardless of the clinical criteria the provider used to arrive at that diagnosis. Clear statement of the steps to take to report the diagnosis of sepsis. If the medical record has a clear statement of a diagnosis of sepsis, the coder would report the diagnosis of sepsis. If you have any questions about this coding clinic or other coding clinics, please feel free to contact me.